How can you tell if your hand pain is coming from osteoarthritis or rheumatoid arthritis? I've got 4 things for you to check so you can quickly tell which one it is. Number 1 is which joints are affected. If you have pain in these joints right here in your fingers, whether it's your pointer finger, middle, ring finger, even your pinky finger, that's going to be associated more with osteoarthritis of the hand, which is the wear and tear type of arthritis. Also the base of the thumb right here, and even this joint right above that at the base of your thumb, but also way down here at your wrist, those two are associated with osteoarthritis. Rheumatoid arthritis focuses on these knuckles right here. Those joints are the most affected when it comes to rheumatoid arthritis. The second one is deformities. When you think about deformities in the hand, you might get a joint that starts to bend sideways like this, or even backwards, the wrong direction. In rheumatoid arthritis, what you'll often see is that the fingers start to bend outwards to the side like this. Because it affects these knuckles, it's those same knuckles that I'm talking about, the fingers will start to sway or drift away from the thumb. They call that an ulnar drift because of the ulna bone down here at your wrist and forearm. It drifts towards that bone. That's rheumatoid arthritis deformities that you commonly see. But when you talk about arthritis or osteoarthritis, I call it arthritis because most people have osteoarthritis and that's what they're talking about. Then you get thickening at these joints right here at the tips of your fingers. You'll get what's called nodes, or just thick chunks of bone. The bone literally thickens, and my theory behind this is because the bones are being smashed because of a root muscle imbalance. The bones are reacting to the forces over the course of months and years, possibly even decades. And so just like you get calluses on your hands from doing exercise or certain activities, the bones will thicken in response to protect themselves. And so you get those nodes that develop in the joints of the fingers. Now down here at the wrist, where you get arthritis for the thumb, osteoarthritis for the thumb, a deformity that you'll see down here is this thumb bone. It's right here in the meat of your hand, in this chunky part of your hand right here. That bone should be more out to the side. If you look at my hand, this is kind of a resting position of the hand. The thumb will go out to the side, but I can't move it because of the wire right here in this skeleton. This thumb bone should be angled more outwards to the side. That's how the normal hand is postured. But when you have arthritis down here at the base of the thumb near the wrist, this bone moves inwards very much like it is right here on this skeleton. And so what you see is this bone comes in, and you can see how the rest of my thumb wants to shift out. And so people will have this kind of a shaped thumb where this bottom bone moves in, and then this top one, I can't even bend it in that direction, but they'll get even what's called a hyperextension, where this joint drifts outwards right here. It kind of bends extra like that. That's going to be the way that osteoarthritis presents in the thumb. Then you have arthritis in just one hand for osteoarthritis. You'll only get it in a few joints in the fingers. Of course, if it progresses more, you can develop it in many joints of the fingers and eventually both hands. But when we're talking about rheumatoid arthritis, you usually get a symmetrical appearance of it. It appears in both hands, and maybe it first affects this joint, but quickly within months it starts to affect the rest of the joint, the knuckles here in the hand, and it'll affect the other side. And then you might also have rheumatoid arthritis in other joints throughout your body. When it comes to osteoarthritis of the hand, it'll typically just be a few joints, and perhaps you might get knee arthritis or hip arthritis, although it's not directly connected, because if we're talking about muscle imbalances between the palm and the forearm and the forearm muscles aren't affecting your hip or your knee. We got to talk about the muscles in the hip and the thigh and calf that affect hip and knee arthritis. And then number 4, the fourth way to check what kind of arthritis you have is your age. Hand osteoarthritis tends to affect people in their 50s, 60s, 70s, and beyond. But if you have rheumatoid arthritis, it tends to affect people when they're in their 30s or 40s, and occasionally you see somebody in their 20s with it, because this is an autoimmune disorder that affects people early on in life, for which you can take blood tests and figure this out. You should be talking to a rheumatologist, a doctor that specializes in that particular kind of arthritis, in order to properly manage it. But when it comes to osteoarthritis, that's more your age related. I put it in air quotes because I don't believe that 100%. I think it's more muscle imbalances that develop over time and it just happens to show up at around 50, 60s, depending on how your body can tolerate it, that's when things start to break down. But we can fix those muscle imbalances so that you can not allow osteoarthritis to progress in your hand. I've got tons of help here on my YouTube channel for hand osteoarthritis, as well as a program called the Hand Arthritis Recovery Program, where I detail my entire treatment process on how to stop hand arthritis from getting worse and even get your hand function back and get rid of the pain so that you can sleep at night, not have any stiffness, and get back to doing the things you love. Go check out the link for the Hand Arthritis Recovery Program in the description below. If you want to know more about the muscle imbalance that I was mentioning, because I don't really think that arthritis is always age-related, but I explain it in this video right here. It's called The Secret Cause of Hand Arthritis That No One is Talking About. Go check it out to learn more.